Hey everybody, happy Sunday from Wino Friday Central here with Mr. Bernie and Mr. Max, who are curled up having a little nap with their papa here this afternoon. So we certainly hope that you guys have had a great weekend and able to spend some time with family and friends and enjoy life the way it should be. So as always, certainly want to thank our first responders and the docs and nurses and scientists and supply line workers who continue to work hard in this fight against this COVID-19 virus. So thank you all for your continued work. The usual legal disclaimer: I'm not being paid for these personal posts. The information shared here are my opinions only and for the sole purpose of education. I'm not offering any medical advice or medical recommendations under the terms of a doctor-patient relationship. The information regarding COVID-19 is rapidly changing and may already not be current by the time you receive it on here. There's going to be a little more information on the technical aspect update today, as I have not done one of those with the last post or two. So there will be some extra technical updates today that hopefully you guys will find interesting. I'll still try to keep it as brief as possible, but hopefully there'll be some valuable information for you there. On a personal note, the last post that I did on Wednesday, which was the fun post next to the pool when my friend Lori came over to visit, that was a great day and I was feeling really good. And then on Thursday, the wild ride on the COVID coaster decided we were going to go the other direction again. So since Thursday, I've had more of the shortness of breath and the fatigue, a little more swelling going on. But definitely the breathing has been more of an issue again. So the Lasix, the furosemide, the diuretic, is still at 40 milligrams per day. Dexamethasone, the steroid, at 4 milligrams per day. Metoprolol tartrate, 25 milligrams twice a day. I've been wearing the compression socks, elevating my legs as much as possible, and trying to get as much rest as possible. So I did speak with my cardiologist on Thursday, and Dr. Galani, I will be seeing him at 1 o'clock tomorrow afternoon. We decided we're going to go ahead and do an echocardiogram tomorrow, heart ultrasound, just to make sure that everything's looking okay and that there's not some interval development of like a post-infectious cardiomyopathy or some inflammation that may be affecting the heart that's causing these symptoms. So that'll be tomorrow afternoon. And then after that, they're going to place a 24-hour Holter monitor, basically monitor the heart rate and the heartbeats over the next 24 hours to make sure that the pulse rate is well controlled and no type of arrhythmias or irregular heartbeats going on that could be causing the symptoms here as well. So cross your fingers, toes, and everything else, and keep those prayers and good thoughts going that all of that checks out good tomorrow, gang. I certainly appreciate that. And on Friday, then I'll have a repeat high-resolution CAT scan of the chest to re-eval the lungs themselves. When I was initially diagnosed and admitted to the hospital, I did have the classic, what they call the ground glass appearances in both lungs on CT. So that we'll be taking a look at that on Friday with a high-resolution CT as well. Okay, so let's get into technical stuff. So we keep talking about making sure everybody stays up to date with guidelines and changes as all of this is rapidly changing as we learn more and more about this crazy SARS-CoV-19 virus. So the CDC did make a change to their guidelines this week, and that was involving glove use, okay? Our disposable gloves. So glove use isn't a necessary preventative tactic now and may actually lead to the spread of germs. So what they found is people actually became more lax when they were wearing the gloves. They weren't as careful about touching their face, about even just practicing good hand hygiene in general in terms of sterilizing and washing their hands, touching their face, touching other objects. So they actually have said, you know, unless you're a caregiver for a sick individual, where you're going to be at increased risk of coming into contact with their secretions or respiratory droplets, now they do not recommend wearing those gloves. So folks, it's all about careful hand washing, sterilizing your surfaces, not touching your face, and just doing the safe thing to protect yourself from the droplets. So that was a change from CDC guidelines this week. Okay, next thing, smoking. When's the best time to quit smoking? Today. Today's the best day to quit smoking, folks, if you're a smoker. So there was an article published this week. Smoking modestly increases risk for severe disease in hospitalized patients with COVID-19, particularly amongst younger patients without diabetes. Now, they've really been pushing the whole diabetes risk factor along with obesity, but these were particularly younger patients without diabetes. And this was published in Nicotine and Tobacco Research. That's where this was published this week. The good thing is there was no increase in mortality, so that's a good thing. And remember when we talk about morbidity versus mortality, because you hear that a lot, anytime we start talking medical studies, morbidity versus mortality. Morbidity refers to what the level of your health is and your well-being. In other words, how sick are you? That's what morbidity is. How sick are you? Mortality talks about what is your risk of death. So, mortality, what's your chance of dying? Bottom line, if you're a smoker, best day to quit is today. Okay, had quite a few people who continue to contact me about convalescent plasma donation, and I'm really excited to share that, folks, we got a lot of people that have been watching these videos and sharing the information that we communicate with each other on here. And I just want to thank every one of you who has made an effort to go get tested to see whether you're eligible, or who has gone online and tried to register to see if you're eligible, and especially for those who have gone and donated plasma. You guys are saving lives with that, and certainly I'm looking forward to the day that I'm going to be able to do the same. Now, I did have quite a few inquiries and messages from folks in the LGBTQ community who said that they had reached out and either tried to donate or had gone to screenings and had been declined for various reasons. So I did do some research on this and made a couple of phone calls. So the FDA issued revised recommendations in April of this year, April 2020. And anybody can go onto fda.gov, or go ahead and contact your local blood donation center. And they will go over the appropriate screening guidelines with you guys and let you know whether you're eligible or not. So the answer is, as long as you meet the appropriate guidelines, yes, you can donate not only convalescent plasma, but blood products in general. So remember, we still need whole blood, we still need regular plasma, we still need all that stuff that saves people's lives every single day. So if you're eligible, if you've had COVID-19 and you're fully recovered, you feel great, and you're interested, please certainly at least go online and do the screening, or contact your local blood donation center, and they'll be happy to go over that with you guys. Thank you to everybody who's reached out, and especially to those who have already gone and given that gift of their convalescent plasma. There will be a new COVID testing site for those of you here in the Tampa Bay area that opens tomorrow morning. This will be a drive-through testing site. it will be open Monday, Wednesdays, and Fridays from 7 to 10 a.m. And that will be at the Ruth Eckerd Hall Entertainment Venue of McMullen Booth Road in Clearwater. That is a first come, first serve drive-up testing site. So I know other testing sites in the past, there's been an issue with running out of tests. So it is first come, first serve starting tomorrow morning, 7 a.m. to 10 a.m. Ruth Eckerd Hall, Monday, Wednesday, Friday. Okay. Some people have asked about workplace testing as we're hearing more and more about this. The CDC website has various guidelines for workplace testing based on the type of work that you do or the type of work environment that you work in. Obviously, these guidelines are changing all the time as we learn more about this. So if you have questions or interested in that, I would recommend that you go on that CDC website and you can go specifically to your work type, and that is cdc.gov, cdc.gov. So ideally, whom do we want to test? Everyone. As we're looking to help try to control particularly the spread in asymptomatic patients, and as we have this huge national discussion on opening and returning to schools and colleges and universities and daycare centers, this has obviously become a huge topic that really there's no easy and simple answer to. These are difficult discussions for everyone involved. So I just ask that you do your homework and try to make what you feel is the most informed and pertinent decision for your family and for your children and for yourselves. Symptomatic. So the big three symptoms that we look for here, folks: fever, cough, shortness of breath. If you have that, it is recommended that you get tested immediately. Also, if you've had a known exposure, whether it's workplace, whether it's home, whether it's with family and friends, it doesn't do any good to go get tested immediately. So the information that I saw said probably the best time to go is around that 5 to 7 day mark post-exposure. Because if you've been exposed to that virus, if it's going to start growing, we got to give it a little bit of time in order for that test to show up as being accurate, whether you're truly positive or not. Now, there's obviously still going to be some false negatives that occur, but 5 to 7 days post-exposure is when we would expect to see a true positive test. Now, speaking of which, there are no diagnostic tests that have been approved by the FDA for the diagnosis of SARS-CoV-19. All of these tests that we're doing are only available under what's called EUA, Emergency Use Authorization. In late July, the FDA expanded authorization for real-time reverse transcription, polymerase chain reaction molecular assays. Now, these are the nasal or the nasopharyngeal swabs where they go back and basically feel like they tickle your brain through your nose. These are the tests that are accurate for diagnosing acute infection. The serology antibody tests cannot be used to diagnose acute infection, okay? I know people are touting those. You can even, I think, sign up online and get an antibody test. That is not for acute infection, folks. That antibody just tells you whether you have antibodies that were produced either from having the virus in the past or from being exposed to it. Also on the FDA.gov, you can go to this thing called In Vitro Diagnostics EUAs. You can look at the individual tests, and that'll tell you the results in terms of their sensitivity and specificity. In other words, how accurate are those tests that are being done. One of my med students reached out and asked if I would touch briefly on the pooled testing that was in the news. Great question, so thank you for asking that. So it's called pooled testing or batch testing. And what that does is it combines respiratory samples from several people And it allows them to conduct one lab test to detect the SARS-CoV-19 virus. Now, by allowing the lab to test multiple samples at one time, it decreases the result wait time. It also helps to save the assay so that we don't run out of testing supplies and equipment as quickly as we were before. So that's a good thing. And the way it works is they'll batch several of these tests together and run them all at once. If the entire pooled sample comes back negative, then it's felt that all of those patients who were tested were negative and they're cleared. But if something lights up positive in this batch, then each individual person or each individual sample there is tested, and then they can identify which of those is positive. So an entire batch that's negative, considered negative. If something does light up positive, then those individual samples are tested in order to identify and then hopefully trace the positives. Now, batch testing should only be done in areas where the number of positive test results is expected to be low. We're looking for low numbers here in terms of prevalence. So if you've got an area, that's running a 10 to 15% positivity test rate, these are not areas that we want to be doing pool testing. We're talking about areas that are probably below 5%. So they need to be low risk areas. But that's where that form of testing comes in. Okay. That's why it's so important that we have accurate data as well as scientists and physicians in our communities in order to track these infection rates in any given community. We got to follow the science, and in order to follow the science, we need accurate data. Okay, there's an article published in HEMONC today on August 5th, 2020 by Dr. Jeremy Warner from Vanderbilt Ingram Cancer Center, part of the COVID-19 and Cancer Consortium Registry. Here we go talking about hydroxychloroquine, Plaquenil again. Hydroxychloroquine in combination with other treatments including azithromycin, remdesivir, Actemra, high-dose corticosteroids. Hydroxychloroquine Hydroxychloroquine alone did not appear to increase the mortality rate. As an interesting side, there was no benefit seen for steroids in patients with cancer, which is a different finding than what we saw in the UK recovery trial, where we saw that steroids were extremely beneficial in hospitalized patients. The difference here was in the UK recovery trial, unfortunately they didn't explicitly gather data on cancer as a comorbidity. So we need more research and data, particularly in cancer patients, and we need to follow that science as well. But that's through the consortium with the COVID-19 and Cancer Consortium Registry. In another article published on July 10th of 2020, in the International Journal of Laboratory Hematology, this is some good science geeky stuff here. This article entitled "Absolute Lymphocyte Count is a Prognostic Marker in COVID-19, a Retrospective Cohort Review." This study showed that an absolute lymphocyte count below 1,000 on admission is associated with an increase in ICU admissions and organ damage as noted by acute kidney injury or AKI. Patients with lymphocytopenia had a more than threefold increased risk for requiring ICU care compared with patients with a normal lymphocyte count at the time of admission. So that's a little simple number that comes off of a simple CBC, which is run right there in the emergency room. So that's kind of interesting, and we may be starting to use that more in the ER setting as a prognostic indicator. Okay, so there's a little bit of some fun technical update stuff. Sorry I got a little long-winded here. So, I hope everybody had a great weekend. Please enjoy your Sunday afternoon and evening. Thanks for taking time out of your busy schedules to watch the update today. Hopefully you guys continue to find these things useful and beneficial and educational, which is most important to me. I appreciate you guys allowing me that time to have the rest between these posts. And I certainly want to continue to thank all of you for your prayers and your encouragement and your love and your support. It truly does help me feel better. It sustains me. It gives me strength on these days when I can certainly use that boost. So be kind to one another, gang. Be kind to yourselves. Let's make this world a better place. God bless all you guys today. Thanks for everything, and we'll chat again soon. Take care and happy Sunday, gang. Talk to you later. Bye-bye.